Hello, everyone. Welcome to the Pathways to Family Wellness podcast. My name is Dr. Brendan Reardon, pediatric and family chiropractor. And joining me today is our friend and colleague, Dr. Lisa Geiger. Lisa, thanks so much for joining us.
Oh, I've been wanting to do this for so long. This is awesome.
Ditto, ditto, absolutely. And for those folks to give a bit of an introduction, Dr. Geiger teaches a really neat course through our organization, through the ICPA, connecting with parents, babies, and supportive care providers. So our topic today, I really just want to talk about connecting with moms and babies, chiropractic care for moms and babies. Dr. Lisa has a really unique skill set as well. And I apologize, I might call you by many names. If you have a preference, Dr. Lisa, Dr. Geiger, Lisa, anything, whatever is fine. This will be great.
Mhm.
But this is going to be a good time. But I'm hoping you can just talk to us about some of the common conversation pieces that come up in practice for you, ways that you're connecting with parents and things like that, and how you're explaining what it is that we do, the amazing mystery of what this whole thing about chiropractic care is.
Oh, that's beautiful. Yes, absolutely. So we have a lot of parents calling our clinic about their babies. They're concerned, they've gotten referrals or they've sought them out themselves on Google. And we have a great reputation. So the work that we do is extraordinary. I mean, an extraordinary opportunity to support babies and parents.
Yeah.
So they will call in if the child has a symptom that is of concern, or if it's been recommended in relationship to some tongue tie stuff. We can talk more about that. Or also, they'll just be like, I want my child to have the best darn care possible. And chiropractic seems to be the best established and researched pathway to that. Can we
Yeah.
explore it with you? And eventually, the whole family ends up under care and they never get sick. And it's a lovely dance to do with the families.
Yeah. And what's that conversation like? Like, so someone calls the office and then has maybe comes in for a visit. I'm curious what the common questions you notice folks tend to be curious about. You mentioned symptoms of the tongue tie, but what are some of the common questions that come up? What are some of the common ways you're talking about what you do as well?
Well, when I'm talking about with them on the phone, I make a point of getting on the phone if it's a new patient with a baby
Hmm.
and say, have you got any questions for the doctor? Because a lot of folks have a couple of common ones. And
Yep.
they're like, oh, yes, thank goodness. And so the first thing they want to know is what the heck is up with chiropractic for babies? We've never heard of this.
Hmm.
But back in 1895, this is a lot of how it started. This has been what it's all about. I tell them I've never gotten a toddler coming in going, oi, my sciatica. I can't reach my Legos. I just never get that, right?
Yeah.
And so it's rarely about symptomology that the baby's expressing. Sometimes it's concern about a lack of function that the parent's not seeing, or there's delays in milestones or things like that. Sometimes, a lot of times since the pandemic, it'll be about a torticollis, which is a great name for a wry neck or a twisted neck,
Hmm.
and how that's affecting their ability to nurse and be comfortable. And then my concerns always are, how is it affecting their ability to exist in a world where they need to develop neurologically their relationship to gravity and how they're going to adapt to the day by day stress of being a baby post pandemic. So
Yes.
there's a lot of patterns that we see, and therefore we can work to prevent concerns about. And then always, I want to get them to where we're more focusing on vitality and how to have this baby thrive and smile at you every day.
Yeah.
And we slowly put the concerns to rest and show the parents how the baby can thrive going forward, and often get into a conversation about their life when they were younger, what problems the parents had as babies, and how they're happy to address them in their kids because they never got addressed in them when
Yeah.
they were kids. Yeah.
Yeah, that's exactly it. We get that a lot in the practice as well, where like, oh, I really wish I'd had this when I was a kid.
Right.
And it is a beautiful thing that is becoming really a more normal thing. I mean, on the one hand, it's like I've never heard of this before, but on the other hand, it's becoming a much more normal thing for babies to get checked as well.
Right.
And even we've been in practice for 12 years now, so we're no old salts, but we've seen some changes happen. And like in
Yeah.
that time, we're seeing a lot more where babies may come in even before parents come in. Whereas if
Yeah.
you go back a generation ago, that would be really strange to see something like that happen. But now you're seeing the babies coming in first and then the parents coming in afterwards.
Right.
Yeah.
That's very common. And I'll always mention to the parents, I'm like, okay, so we've talked about your baby. We see what's going on. Everything that they did with your head, mom, you did with your vagina. So tell me when you're ready to get checked,
Yep.
and just let me know when you're ready. And they usually come in about a visit later saying, dear goodness, I'm ready.
Yep.
And then I turn to the dad or the other partner who wasn't the birth mama and say, okay, so every research paper I've read on kids says they're going to get heavier. And once they're about 13 pounds, you'll be carrying them most of the time. So the bigger question is, do you want to get it sorted out now so you're ready? Or do you want to deal with challenges that come up from that as you step into the role of the baby bearer? And so often they're under care. And now they're prepared to handle parenthood with a little bit more grace and ease than they would have. And that's gorgeous.
That's beautiful. That's beautiful.
Yeah,
Now, you had mentioned earlier, I want to touch on a bit, you were getting a lot more calls about torticollis since the pandemic.
craziness.
Was there
Yeah.
anything in particular you think because of that that was, I always find these asides really interesting if certain like environmental triggers cause certain things, or what do you think the connection is between those two?
As far as I can figure, and you may or may not be aware that I went from being a cat person to a dog person in the last 2 years, right? So one of the more interesting things I've seen is when my dog is scared, because he's a medium-sized dog in a big dog world, he will tuck his little tailbone and he almost arches into a whole horseshoe, like one of those gorgeous Italian pastries. He's
Hmm.
just way up like that. Um, and that was a lot of people during the pandemic. We express
Mm.
fear through fight or flight, right? And we express fear through tucking our pelvis and hunching our head and being ready to fight or flight. That is such an interesting time to experience that during pregnancy. There's this
Mm.
great guy named Bruce Lipton who wrote a book. What was that book called? The Biology of Belief.
Yep.
And he talks about how all the chemicals of fear during pregnancy in some level get transferred to the baby. So as mom is dealing with fight or flight, um, in that particular scenario, blood will go to the muscles. The back of the brain is more active than the front of the brain because you want to run, not do calculus,
Yep.
and the baby gets a smidgen of those same chemicals because their liver clears things slower, right? So you end up with these little babies. And the rule with babies is where there's more blood, you develop more. So these guys come out with all the blood having gone to their muscles. So they're little bruisers. They're back of
Mm.
the brain, kind of babies, the ones who are so tense and have a hard time reacting.
Yep.
Just on that level, there's an effect on the baby.
Isn't
But
that
then when it
interesting?
comes to a vaginal birth, we're talking about trying to push that baby through a tucked pelvis and a hunched body, and it's not surprised they come out twisted and torticollis.
Yeah. That's so
So birth
fascinating.
trauma.
Yep.
Yeah,
That's
it really
exactly it.
is.
Yeah.
Do you know what the line is for calling whether one of the things for deciding if there was birth trauma in a birth is how long the pushing was. If you pushed for more than an hour, automatic sprain strain.
Wow.
So yeah, and we have people coming in who are like, I just pushed for 4 hours. I don't know why there's a problem, but it becomes more obvious as they start to understand the process, and that is rough on mom too. Let me tell you.
We think about a goal marathon time for a lot of people is 4 hours. A marathon is no joke. So, that's
I didn't even think of that. I'm going to use that. That's
yeah.
cool. Now these kids come out and they are twisted, and
Oh
a
yeah.
lot of times you'll also see this. Doink. Ones are pulling off the boob and they want to have their head back, and that's from something called dural tension. And dural tension means the covering of the spinal cord is the dura. It's tough. It doesn't stretch. It actually stands for the dura mater. Dura is durable. Mater is mother. It's the tough mother. What
Yep.
can I say? And
Yep.
mama's got to be tough, no
Yep.
question. And it goes on and connects to the tissue that's inside the skull, lining the skull and making the hammock that the brain sits in. So now, if you've got problems up here at the top of the neck, or as we call it, the upper cervicals, then the kid's going to have this is going to feel more comfortable than this.
The
Now, this
extension
affects
posturing, right? Yep.
that's
Yep.
it. Have you seen a lot of that lately? It's out of control.
Oh yeah. Stargazer syndrome. That's
Stargazer syndrome, you got it.
yep.
And so the more we can work on that, because look at me and swallow, right? Now extend your head back and try to swallow,
Ooh,
right? Now
that's hard.
tuck your chin and try to swallow. With the head in a normal, relaxed position, you have great transfer of milk. But if you've got all this tension, curly Q stuff in the neck, that's another place where babies end up with upset tummies and pinching diaphragms and things like that.
And do you think you see more often than not people are trying to treat the end organ issue instead of the central neurologic one? Or I guess if put it in more lay terms,
Talk to
right?
me what you mean by that. Yeah.
Whatever the end of like, oh, you have an upset tummy, let's give you something for your tummy. But meanwhile, the upset tummy may be caused by a level of high tension within the nervous system, causing
Right.
pulling and a high high tone, leading to,
Absolutely.
yeah,
Yeah, so people are often chasing after the symptom. Sometimes this leads them to chasing after a bright, shiny object that might fix it all, or
yep.
or a pill that'll fix it all, or some people get into stretching the twisted necks, but that doesn't
Yeah.
solve why it's twisted. Yeah, I think you're spot
And then
on. And
more
I
often
was
than not,
explaining, oh, go
yeah.
ahead.
Oh, I was gonna say more often than not, we're seeing parents, I mean, people, especially parents for their kids, they want a solution. They want to know what's actually happening,
Yes,
let's just treat the symptoms. Like we get this a lot without even asking of like I want to understand the root cause of what's going on. Like
that is
why help me
beautiful.
to understand why this is happening, right? That's really the question that we're getting.
Yeah, and even the descriptive terms that I hear coming our way is that it is more about the symptom and less about where that symptom might be coming from,
Yeah,
right?
okay.
So torticollis, they had a lot of pushing during the birth, and now the neck is twisted. So what's the solution? Let's twist it the other way to stretch. Okay, that's not a permanent solution. Kids learn to adapt within the first month or two, so they'll look more normal, but they are not in balance yet, and they don't have a clear nervous system yet.
Yeah, that's exactly it.
Yeah.
And inevitably with little ones that have one of those, a head tilt or a torticollis, if it wasn't
Mhm.
corrected by a well-trained pediatric chiropractor, even little ones that we might check at age 5, 6, 7 years old, there's still hints of that remaining.
Yeah,
Even though it may have been
absolutely.
stretched and worked through and all the range of motion, but because the misalignment and the subluxation, as we call it in chiropractic, was not addressed surrounding that, there's still bits of that remaining. That's what I'm sure you found that as well. That's what we found in practice, where it 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 has to be addressed in terms of dealing with what the actual cause of the issue is, instead of working
Right,
with the tight muscles, which is the effect of the cause.
right. But the very visual one, your problem is your kid is twisted.
Yeah,
No, your problem is that something is causing your kid to be twisted, to be more
right.
comfortable.
Yeah.
So just last night, I was talking with another chiropractor. We do a lot of work on this stuff. And we are thinking, okay, if their position of comfort is that, right, we have to address the underlying cause, or that becomes their position of distortion, their posture of distortion as they get older.
Mm, okay.
And let's talk long-term effects for a moment if you want to.
Sure. Yeah, let's
You
do it.
ready?
Mhm.
There's an ambulance going by in a minute, sorry. So if a baby is more comfortable this way and that way, they dabble into something we call jet syndrome. Have you run into this at all?
On account of going through your course, but and for our listeners, Dr. Geiger, Lisa was looking up and to the left. So as we're looking at like a torticollis or a posture like that as well. Yep. So we've got,
Tilty,
yep,
extendy, right?
yep,
And so
tilty
jet
extendy.
syndrome is just a visual checklist that you can look at to say, well, they did kind of stretch him out, but I'm still seeing some weird stuff. So J is for jaw. If your kid's got a torticollis, so many times their jaw will go off to the side when they yawn instead of down. And gosh, it's cute in those newborn pics, but it's problematic later.
Mm-hmm.
E is for eye. Is one eye always bigger than the other? And it can switch back and forth. And if so, it means one of the bones behind the eyes is actually pulled back to unbalance things.
Yep.
That's a bone that connects with almost every other bone in the skull. So we call it mama. If mama ain't happy, nobody's happy.
Yep. That's
Um,
right.
and then T is for tilted, turned, or twisted. Does your baby favor looking one way? Now, after a month, you'll think that they're turning evenly to both sides, but what they've learned to do is compensate. So if I turn this way, my jaw reaches my shoulder. If I turn this way, my jaw goes this far, and then I move the shoulder, so it looks like I'm looking over to my right, but it's not a true rotation shoulder to shoulder. So look where the jaw lines up with that. So if you see a baby with one, two, or three of these things, the jaw, the eye, the tilt, turn, or twist, there's something neurological and skeletal going on there that still needs to be addressed, no matter how normal they look.
Yep.
Um,
And now, what are
and
some of the effects of that? Let's say that goes
yeah,
unchecked. We talked about compensation patterns. What could that look like unchecked later on?
um, well, a couple of things. The first one chronologically is in the first couple months, your baby is going from a fresh to the world baby to figuring out what is up and what is down, right? And that's gravity. So what is its take on gravity? And if they get a somewhat skewed version of gravity, that this is normal for them, instead of that, Well, it's going to affect how well they can move their eyes in one straight line later when they're learning how to read. Do you get that? And
Yep.
so that is those are the kids who come to me when they're about 6 years old and they're like, well, she's liking reading, but we have to use a ruler to keep her online.
Oh yeah.
And yeah. And if it connects into one of the primitive reflexes, that just sparks up some more long-term um, consequences, which should we go over later or now?
Let's do it now, and especially even the concept of primitive reflexes. We have a lot more parents coming into the practice who are already familiar with what that is, um,
Mm-hmm.
and also it could be worth if you're able to do a quick overview of what is a primitive reflex, what purpose they serve, and how might that play into what we're doing here too. So,
Absolutely, sure. Well, I'm going to finish the question you had a second ago.
oh
So,
yeah,
how could this affect a baby
yep,
if they've got the tilted, turned, or twisted? The other thing I want to bring into play is now this is a little complicated, but just bear with me, people. If you want to turn your head one way, this is my left, right? The muscle on the right has to tighten. We got it? So
hmm
it yanks it around. If you put one finger behind your ear and one finger on your collarbone, when you turn the other way, it shortens the distance. So this muscle pulls the head around. If it keeps pulling, that's where the tilt comes from. Got it? And here's the thing about the skull. When they're born, the skulls are very, very much pieces of bone floating on tissue as they are deciding where they should end up and how they should form together to make a more solid skull as the baby grows. So if this is pulling 24/7 on that bone, about a month later, this one goes flat. And everyone's like, it's because they're lying on it. Well, it's in part because if you pull here, a month later, this one goes flat. So you know you're making real progress with your chiropractor, where after about a month of care, the flat spot pops back out, normalizes. When this tension is gone, because the chiropractor has sorted out why it was pulling all the time, this side of the head gets much happier. So that gets into what's called plagiocephaly or flathead syndrome,
yep,
whatever. But
precisely,
there's more to it than just throwing a helmet on to round it out, right?
right.
What there's more to is getting to the underlying cause and allowing it to heal itself naturally. Otherwise,
Yeah,
there will always be some extra torsion that you don't want to deal with.
yeah, and I forget who mentioned this the first time, but the child many times will compensate, and
Mhm.
to an untrained eye will appear like they're getting by okay, but they have to work a lot harder to do normal things. And so
Exactly.
sometimes it's very obvious and anyone walking down the street would be able to notice it, but many times it's more subtle. And so the
Mhm.
child is compensating and they're having to work a little bit harder to read, a little bit harder to walk, a little bit harder to run, a little bit harder to change
Yes.
directions. And it usually will be one side dominant compared to the other, not both sides. And
Mhm.
so, like you had mentioned with normalizing the head, if we can get the head into a normal juxtaposition in gravity, a normal position in gravity,
Yeah.
the rest of that person is going to be functioning and working a whole lot better.
Yeah. And study after study is coming out that shows the more we can adapt to our daily challenges and forces upon our bodies, the more vital, the more resilient we are as we step into toddlerhood, as we step into teenagers, God help us, if we step into adulthood, and we're still using up half of our excess energy dealing with these compensations. That's just a lot more buzzing in the head than it has to be. Does
Yeah,
that
that's
make sense?
exactly it. Yep. Yes, it does.
Cool. All right, let's talk primitive reflexes. You ready?
Cool. Yeah, let's do it.
All right.
Okay.
Babies are born with nearly a dozen reflexes. They are the second set of reflexes that they deal with. Anyone who's ever had an ultrasound saw the little jumping bean jumping around in the uterus. And you're like, why are they just jumping? Do they not
Uh-huh.
like the ultrasound? Well, maybe. But even more, that set of reflexes keeps the arms and legs flapping so that they don't develop fused to the body or fused to each other. It's there for the purpose of proper development. So those are the fetal reflexes.
Interesting.
Next step is the ones that they're born with. And this is fascinating because these reflexes are the second of three sets that we get. The second ones are to allow us to go from a fluid or womb environment to a really interesting interactive gravitational based environment, right? But they're also there to help with the birth. 11 out of 12 of the reflexes are actually helping with the exit strategy. If we learned anything from politics, it's like always have an exit strategy, right?
Yep.
So one that will make sense to you, I brought my little friend Fred.
Oh yeah.
Uh, when Fred is coming down and we're trying to get the head out, kind of the trickier moment of the birth, right? And so they start out facing one way and eventually they end up facing backwards if they're well positioned,
Hmm.
right? And the head will come out and their first view is the back of our backside. Welcome to the world, but okay. And they come out, we wipe them off, we snuggle them, and that's cool. But um, when that head is trying to come out, also the biggest push that we've ever had. So why am I still talking about this? So the head is there. Brandon, I just left my train of thought. We're gonna
That's
clip this.
okay. We're going over
Okay,
and we're going over the primitive reflexes that
primitive.
help in the birth process, right? So you've got
There
the
we are.
yeah.
Thanks, buddy. All right, so the head comes down and it's right at the exit, and the gosh darn it, why did this happen again? Okay, here we go. The head comes down and it gets to the exit, and this is where the feet, which were all curled up in the uterus,
Yes.
have uncurled. Now, if you've ever played with a young, very young baby, you push on the feet and the legs go twang.
Yep.
And if you stand them up and do it, it looks like they want to walk, but it's really a reflex that makes their legs straighten. So here's Fred trying to get out, and the legs have come up like this, and they're just in the position and the right distance for the uterus to contract on top of the feet, make the legs go twang, and help that head get out the exit, get out of the vagina. It's a
Amazing.
miracle, right?
Amazing.
And so that those contractions help with that part. Then another primitive reflex comes in, and the pubic bone is stroking down the back of the spine, and that makes them arch. So that
Yep.
helps them come out a little bit easier.
Hmm.
So all these reflexes are in there to be able to help with the exit strategy, and it really makes a big difference.
Well, and it's incredible. We know so little about the body, and even what we do know, how much points to the incredible wisdom of this process. Like
Right.
if we
Yeah.
were if we were to try to recreate this, we would miss so many steps, so many
Right.
steps, right? There's so many different things that we may have thought, oh, look at the baby's just moving in that way. That might not be significant. And then we discover, wait a second, this is actually crucial for their survival and their entry into the world as a part of the exit strategy, right? You've got that
Have you
extension reflex, the legs shooting out. A fun thing,
every
my oldest was born in the water and he was kicking before he was breathing because he was underwater, kicking his little legs to get himself, looks like he was trying to like kick himself right on up and out. It was
that's
actually really cute. Yeah.
probably also was his first time out of that tiny little studio apartment that
That's
was her
exactly
room.
it. Yep,
Yeah.
yep. Just kicking those legs, kicking. Yep.
Well, uh, when it comes to, let me, this is a great example of the miracles we don't even know about. Breast milk, extraordinary stuff. There is down the street from me, there is Harvard University, and they have one whole department on breast milk research. Now, I am absolutely sure with a proper latch, there's a million things that happen, but here's the two they figured out so far. Number one, if the baby's latched on and gets a whole mouth over the areola, which is the dark area around the nipple, the milk comes out the middle, but there's little glands around the side of the areola that takes in a little bit of baby saliva. And it
Amazing.
evaluates what the nutritional needs of the baby is at that moment. And the next milk that comes out has grabbed those nutrients from mom's body and put them into the next milk the baby gets.
That's incredible.
Isn't that amazing? That
Yeah,
is just amazing.
for that process
Um,
to work at that speed with that level of skill and precision, you know,
Here comes the second one. If what do babies put in their mouth?
everything.
Everything, right?
Yeah,
Right. So baby gets on the breast, it takes in that saliva. If there's any germs in that saliva, it goes straight to mama's bloodstream. And then the next milk literally has antibodies to the things baby put in their mouth that morning.
that's incredible. Could it be
Isn't
antibodies even if mom doesn't have those own antibodies
Yeah,
herself?
yeah.
So
Yeah,
the
it
bu-
tosses the germs into the bloodstream, da 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 da, does its
so
little
mom's
science.
body will manufacture brand new antibodies for that, even if mom's never been exposed to that like germ supposedly, right? That's
How can
incredible.
one doubt the brilliance of the body?
That's amazing.
How amazing. Yeah. So
Yeah.
that's just the two things they found out. I am absolutely sure a million things happen.
Oh yeah. There's so many
Yeah.
more. That's just what we know. I mean, the more that we know. Um, And the more, I think that points the direction of the more that we want to support this natural process happening the best way that we can, right? Because there's so
Absolutely.
many ways that we intervene, interrupt where there's potential consequences for that. So, you probably see with some babies you work with that some of those reflexes that you talked about may
Mhm.
be there beyond when you would ideally want them there, or may not be there at all, and they never activated. And there can be, different issues I'm sure that would arise with that. I'm wondering if you want to go down a bit of a tangent, we can talk about what that might look like.
You know I do.
Yeah.
And in Europe, they call it persistent primitive reflexes. In the US, they call it retained for what it's worth.
Yep.
And let's talk about that, the ATNR, big name for what they call the fencer's reflex. So if I am a baby and I turn my head this way,
Yep.
one arm goes straight out, the same leg goes straight down, and this one goes back. It's like, unga, unga, unga,
Yes.
right? And it's cute and it's fun, but it's also really interesting. And it's part of the baby's development. The other half of what these primitive reflexes do is help the baby learn to interact with gravity appropriately and adapt to this new world they're in. So you got your ATNR, and that should be going by 12 months, optimally 18 months if they're running late.
Yep.
But if that's still around, then there's different things that happen to that child as they go. And I had a retained primitive ATNR, no question. If you ever see the kids in school and they sit and one leg sticks out behind them in the chair and the other one is forward, I wish you could see what my body looks like right
Yep.
now, but there it is. That's because the kid has a retained fencer's reflex. So here's little Johnny. Johnny's sitting in the classroom, and teacher is like, Johnny, get your leg in. So he keeps pulling it in. It goes back out. Johnny, get your leg in.
Yep. Yep.
Anytime that he is trying to write, the shoulder also wants to go out while that leg goes straight. Okay, Johnny, get your leg in. Johnny, put your shoulder down. And meantime, Johnny's trying to copy from the board. Well, what happens with the ATNR is that it slows down the changing of the focal vision from far away to close, far away to close. So now Johnny's got to manage his shoulder, manage his arm, manage his leg, and copy just a bit slower than the other kids from the board, right? And also, there's an overlap. I found an article of being able to sense the passage of time can be affected by this reflex hanging on. And it often
Wow.
overlaps with people who have ADHD. So get everybody with ADHD, get over to their office, okay, to the chiropractor's office. So they put folks of different ages in a little booth and they turned on the light for 15 seconds and then turned it off and said, how long do you think that was? And the typical folks are going without the ATNR, they're like, 15, 20 seconds. And the ones with the ATNR is, oh, yeah, that was about a minute.
Wow.
Yeah, it's like that movie Over the Hedge where the little creature senses the passage of time much differently as the little hyper squirrel. It's like that. It changes the way that our kids and us navigate the world if these reflexes are retained. If the child that started with a simple torticollis and preferring one boob now has longer term effects that are much harder to work out of the body. So to get that kid just developing optimally and vitally and resiliently, just get them checked at birth. I urge my patients who are pregnant, stop by on the way home from the hospital.
Hmm.
Let's reset your pelvis. You're going to like having that reset right off the bat.
Oh yeah.
And I've never had a mom not go, oh, thank God, after the adjustment.
Yep.
And then we check the baby, a lot less chance of nursing challenges, start
Yep.
to touch these things right in the beginning.
Now, do you see, this is kind of an aside again, though, but with some of these
Mhm.
little ones, I found that it can take a couple weeks before some of the pattern sets in, like in terms of like
Absolutely.
some of the retained, some like the issues that might emerge because they're still so fresh, they haven't quite settled into gravity yet. And so
Exactly.
like the subluxation patterns are the patterns we might find. I know I talked to Andrew Doro about this as well. Um,
Favorite.
and I found like that we always want to check them as soon as possible, but that 2 week mark sometimes what's going to be a
Mhm.
pattern, if it's going to be persistent, usually shows up around that time. And I'm not sure if you found that to be true or what you think the reason for that might be, other
I
than it
think
just
you've nailed it on
takes some
all
time.
accounts,
Yeah.
asked and answered.
Yeah. Okay.
Um, yeah, but also don't forget also that as you begin to adjust them when they're just newborn, babies I find have patterns usually for two reasons. It's either how they baked or how they birthed,
Yep.
right? And so the baked ones may have been in place for 3 months.
Yep. That'll be there for sure. Yeah.
Yeah, and then there's the birthed ones, which are a reaction to whatever process. Too fast or too slow, both can have profound reactions.
Yep.
So I wish I knew more to tell you, but I
No,
think
I
you
think
got
that's a great answer. Yeah. And in terms of
it.
some of those the reflexes, what are some things that might for that ATNR you're talking about, that fencer's
Yeah,
pose, the kid that's in the seat with his leg
yeah,
back, that's, having
yeah.
trouble focusing? What might cause a retained ATNR?
I would say torticollis right
Okay.
off the bat would be my
Yep.
first guess,
Yep. Yep.
right? But
Yeah. So how you
birth
birthed and how you
trauma.
baked. Yep. How you baked, how you
Yeah,
birthed.
and
Yep.
nobody really talks that much about birth trauma lately. Jeannie Ohm was all over this stuff. Jeannie Ohm was
Yeah.
our mentor, chiropractor, who did so much pediatric research and
Yep.
even more promotion to help people understand.
Yep.
But the amount of birth trauma, especially since the pandemic, is stunning.
Yes.
And let's not leave off how these kids got very different environmental impacts after they ended up at home. Like, okay, we got masks for half the time. So we're losing all the input of the social expressions. Um, yeah, and mamas and papas being in such fear as many people were for the 4 years. Some people were profoundly affected by this, and some were able to just glide right through. But uh, the more you can normalize moms, dads, and babies' nervous systems, the more they can heal from this.
Yeah. 100%. And that's beautifully put as well.
Thanks.
Yes. Now you had mentioned so much since the pandemic, right? Because we've got that fear curled posture in, that
Yeah,
horseshoe that you had mentioned as well. So, and you had said basically anything more than an hour of pushing would classify as birth trauma as far as you're concerned. So,
absolutely.
it stands to reason that pushing phase and quite frankly the incidence of cesarean skyrocketed as well.
Shock.
Now, for a surgical birth, what what might you find that would be different if someone's had a cesarean or a surgical birth versus a vaginal birth? How might that kind of play into a conversation piece or an analysis for somebody?
I think the first thing is that I'm surprised how many people, and this was me before I got more educated about it, think that a C-section, you just reach in and you just scoop them out, and you draw them out gently. And I didn't realize how violent the tugging can be, that they're going to try and make the smallest scar possible because bikini season is coming. So baby has a smaller exit.
Mhm.
And they're going to grab whatever they find when they open mama up. So they may be pulling out by an arm, or they may be pulling out, if they're lucky, by the head, or they may be pulling out by one leg but not the other. And given that C-sections are often um, mixed in with positioning problems, like babies who are breech, or babies who are
Mhm.
sideways, or babies who are twisted, or the big word is asynclitic, which sounds like
Yes.
a good name for a band, but it's not. And asynclitic means that the baby, instead of coming down the birth canal,
Yep.
they end up by mistake with their head like this or with a face presentation. And now instead of breaking the way with the top of our crown, which is prepared for it, which stacks up all the bones in the neck to be protected, we got a major whiplash, right?
Yep.
So asynclitic births as well just really are often why they will pull the baby back and now take them out C-section wise. So they got down, they pushed a lot with the head twisted or tilted. Now they've gotten pulled back out of the tight spot. So there's that. And then they're getting pulled out by whatever. Yeah, there's a lot of room
Yeah.
for things to get twisty there.
Yep. That makes sense. And then have you noticed a difference versus a emergency cesarean versus an elective cesarean in terms of the amount of trauma on
Absolutely.
the baby? Yeah. Yeah.
Both in terms of how far down baby's gone.
Yep.
Well, they don't get the flood of hormones that would come with birth that their bodies expected. They are getting a lot less trying to back it out of a bad situation,
Yep.
right? And I think it's a different experience for the mom as well. It's so much about an emergency C-section means mom has a feeling, either quietly or loudly, of losing control of something she expected,
Yep.
right? She expected a birth one way. Now we got this emergency. You don't have any control stuff here. And it can be a planned C-section can allow you time to empower yourself through those. I was
Yep.
just reading an article in Pathways magazine, which I love, about C-sections and how to empower that. They drop the blue thing and have a
Yeah.
clear skirt for them to look through at the baby, to see the baby the second the baby comes out. And there's ways to do it with more empowerment than an emergency C-section would allow.
Yep. No, 100, or like a gentle cesarean. I think some places are calling that as well. There's a lot of
Oh, I
different
like that.
terminology for that. Yeah. And would you expect to find less reflexes that are activated in the birth process then with I mean, I find this stuff
Well, that's a
fascinating.
good
So
question. Everything
yeah.
I read about that is from the studies that were done in Europe because I had an emergency C-section in Europe. So of course I'm going to read everything I can.
Yep.
And one thing that was recommended, I went and worked with a wonderful woman named Svetlana Mozgatova, who works a lot with primitive reflexes. And one of the people there at that program um, said, you want to take this baby and you want to get them naked and put them down on a shower curtain or something and get a whole lot of olive oil. And you want to just oil them up from head to toe and support them and give them long strokes from the head down to the feet on all sides of the body because it triggers the sensors along the skin that we're expecting that big squeeze and the big push on the
Yeah.
way out. Yeah, and Jacob dug it. And I tell you, his neurological profile changed. Jacob is my son, of course,
Yep.
changed drastically after we did that.
Yep.
It
That
was
makes a lot of
wonderful.
sense. And I could
Yeah.
think even just the yeah, the stimulation of that, the
Mhm.
activation of some of those,
Mhm.
the movement of the cranial bones as well. I don't know if we touched on that somewhat, but I liken it to like the plates of the earth where there's a very
Just like that.
subtle, gentle rocking that happens where two of the plates come together. You might see some ridging where the plates pull apart. You might see things drop down. So,
Mhm.
um, but with a with a vaginal delivery, there can be a lot of pressure and torque that can happen. With a
Mhm.
cesarean, it's usually going to be less torque on the head per se, but there's still
Right.
lots of forces that can happen. With an elective, there's typically no forces, but that can carry with it some potential issues because some of the benefit of a vaginal delivery is that the cranial bones start to pump and mold themselves and start to move. And so there's a gentle movement. But sometimes that feels like a difficult concept to explain. So I'm curious if that's something you touch on with your folks and what that conversation piece looks like in terms of the potential things to look for, to check for those.
I check that on every baby. And
Yep.
what's interesting is there's ridges. Well, how do I put this? If you look at a baby's head and they're going through the contractions, it's going to make some of these plates overlap and telescope in for a smaller, more compact skull. Now, that's
Yes.
to be expected. That's normal, right? And we're like, smaller, more compact, yay. But then these babies come out and they've got these big alien eyes and these tiny little skulls. And most of us go, eee, right? And then within an hour, there's what's called the bloom. And the cerebral spinal fluid, which is the fluid that goes around the brain and down the spine, has gotten a big squeeze, and that helps with the opening of the spine back to what it should be. And
Yep.
one thing that vaginal births have that C-sections rarely have is that huge compression and then relax that helps to guide and enhance and support the normal motion of that fluid.
Yep.
Now, to talk about that overlap that I was talking about, sometimes you can feel gently on a baby's skull and you'll feel this side feels smooth, but this one feels like there's a ledge or there's a speed bump.
Yep.
And that's where there's an overlap that hasn't been able to unoverlap after the birth. And that's what I see the most after birth trauma. So now I want you to think back to that fluid we were just talking about. It's going to run like the Colorado River on one side, and you got crickets and tree frogs over here where it's not moving so well because the bones are jammed. So it's not, that's the challenge with helmets, isn't it? It's going to make it look pretty, but it won't get that cerebral spinal fluid moving as normally as possible, which is where you want to make sure that the skull is being attended to on your chiropractic visits
Yeah,
as well.
that makes sense. And then do you find that being able to maintain and get a good latch is crucial for cranial mobility as well? I mean, not just, let alone
And
the
vice
importance of
versa.
feeding, but yeah, yeah.
Yeah, and
Yeah.
vice versa.
Yep.
If the
Okay.
cranium's jammed up, they're going to have
Yep.
a hard time latching. If
Yep.
they're at a latch that's screwed up, it's going to have a hard time circulating.
Yeah,
It's,
that makes sense. And then
yeah,
you
without,
mentioned at the start we could jump into some of the tongue tie stuff just a little bit. Do you want to touch on that a bit or tether to all tissues?
yeah, I do. Let
Yeah.
me make sure I closed all my things to talk about.
Oh yeah, no,
Yep.
if we got other stuff, let's go there too. We can
Well, I have a classic ADHD jump around squirrel, squirrel, squirrel
No
moment,
problem.
right?
That's what makes this fun. Yeah. Yeah.
God bless you. Let me think for a second. Latching. Let's talk about latching for a minute, and then we'll get to the tongue tie stuff.
Great.
All right. A regular latch has, by my count, about 11 steps to be a really healthy one. If you think about how this is programmed into them, it's amazing. So I'm going to go back to birth first. Well, conception. Conception's
Okay.
fun. And 16 days later, the neural tube starts to form. So the first thing that comes online really is the brain. So I picture we got this little brain with a red hat and tennis shoes, just watching everything happen from that moment on. It's like bringing in the electrician from the start. You want it all wired right,
Yep.
right? And as the brain grows and grows and grows and grows, then it comes time for the birth, and they come out and they breathe air. They've never done that before in their life. No way. That is programmed in through what the brain has grown and wired. Now, right around them, we start transmitting signals between body and brain even more, and it's usually about 30 million signals per second. Helps us perceive the environment and then adapt to it, right? And so
Amazing.
yeah, it truly is. So there we are, and baby comes out and they breathe. And sure, they're a little clumsy at first, but look what they're able to do without us telling them how. And that's the moment for me that the huge respect for the body's ability to have an innate intelligence to guide it through all this stuff just is amazing. So then what else do? They learn how to nurse. Now, nursing with 11 steps in it, you got to think about it. Okay, they got to open their mouth. And most often latch problems have one jaw that's fixated,
Yes.
not tight, but really stuck. If it was tight, we could stretch it, but it's stuck. And so it's got to open and it's got to go down, and the tongue has to get out of the way, and the nipple has to come in. Now it's got to get back far enough to the on switch for nursing. And that's way back. If you put your tongue on the top of your mouth and go back, there's that soft spot, right? That's the on switch. So
Mm.
if the jaw is fixed on one side, the nipple can't get to that on switch, and that's going to be one of the challenges that we have to address. Um, and then the jaw has to come up, the tongue has to come up, the lips have to tighten and make a seal, top and bottom, and then the tongue has to start rippling to draw the milk out of the nipple and swallowing to help bring that suction into place. I mean, and they're sucking, they're swallowing. It's a miracle they can do this at birth.
Amazing.
So yeah, isn't it?
Yeah.
And so the common culprits I see is a lot of jaw stuff and a lot of torticollis stuff.
Okay.
Um, and in my state, which is Massachusetts, they were doing a lot of cutting before they were doing a lot of seeing what else can be addressed first. So best practices in my world says, let's deal with the neurological and skeletal stuff, see if that helps balance things out, reassess a week later, see if it's still tight under there or if it was because the nerves and the muscles were being spasmed and twisted.
Yeah.
So that, yeah. And so I saw a lot of patients in the first 3, 4 years this was around who had been released 2, 3, 4 times and still weren't able to latch. And when we got down to it, there was structural neurological stuff, but now they also had a floppy tongue.
Yeah.
Um,
Okay.
Now they're getting a lot better about making sure that the nerves and the muscles are clear and then assessing if there truly is a problem or if there isn't. And if we're going to talk about tongue ties, we really have to discern between the front one and the back one. Now, the front one is right in the front where that thing on the bottom goes to the bottom of the tongue at the very tip. It might pull it in to look, yeah, and it might pull it in to look like a little heart-shaped indentation, right? And that's a front tongue tie. I will drive you to the hospital for that one. No problem. If it's one of these more elusive back tongue ties and you got a torticollis or you have an extension dural problem, anything like that, you got to clear those enough to read it specifically. Because so
Yep.
many of the posterior tongue ties, once you sort those out, suddenly disappear magically. So
Yep.
it's just, I'm a fan of tongue ties, but I'm a bigger fan of accurate diagnosis. And in my state, that's what we ran into, but I'm beginning to understand that other states had different perspectives.
Yeah, it's an interesting thing.
Yeah.
It's a very interesting thing, and it's definitely a hot topic these days as well. Someone's trying to sort
Hmm.
out what's what.
Yeah, true.
Yeah, and certainly what's nice I like about what you said, there's a lot of conversation around let's try to clear out the neurological and the mechanical things and see what's really going on back there.
Right, because it can really mask it.
And that
Okay.
kind of goes into the jet syndrome you're talking about as well. The jaw, you
I was
got the
going to
jaw
bring it
towards
up.
one side. Yep, yep, and the torticollis. So that's the
So if you see a baby who has the jaw going to one side, the one eye bigger, the tilt, turn, or twist, or any two or three of them, they really need to address their neurological and mechanical stuff before they start cutting anything.
and with
Unless
that,
it's in the front, and then I'll give you a ride.
yep. You're great. Now, is that in terms of things parents could check for on their own, is that something you'd like to leave with parents about like things to look for their own babies, about what how to tell if this is something that could probably benefit from chiropractic care? I mean, I think all babies should be checked, but sometimes things are more obvious than others. So I'm
Right.
wondering if there's
Well, that's why we came up with Jet syndrome.
yep.
And big nod of the hat to tip of the hat, nod of respect to Kristen Dennett, a chiropractor in Easton, Massachusetts. She's the one who came up with the name for that. She
Awesome.
was wicked smart.
Yeah, good people.
Um, and so, yeah, if you see Jet syndrome, that kid needs to have their neurological and mechanical stuff checked, balanced, and then step forward and evaluate again.
Yeah.
You'll know within a week or two if it's making a difference.
Yep, that's great.
You won't be done in a week or two. Let's be clear about that. Usually, baby stuff takes much longer than that because it's been in play for a while. But absolutely check that.
Yeah, excellent. And then, is there anything else you think is good for parents to know about chiropractic care, connecting with parents and babies?
Um, would I say without shame to every one of my patients who's got a baby under care, and also my pregnant ladies, is everybody. Tell everybody. It's not that my clinic is lacking for clients. It's that everybody deserves to be as happy as the parents I see after the baby starts to thrive and stabilize. And
Yeah,
you're giving them a gift that's going to last the rest of their life. Their resilience is established in those first couple years. Like, okay, check this out. In the first year, the brain will double in size.
that's
Now,
amazing.
if the skull is jammed up a little bit, what if it's like expanding here and stuck here? You're heading for a helmet. Good for the helmet industry, but not great for the brain because this side's going to be restricted and this side's going to be trying to compensate. And, there's just very little reason not to get the baby checked and make sure that all is working as well as it can.
Yeah, beautiful. I love it. Well, thanks so much for joining us, Lisa. I really appreciate it. How are some ways that our listeners can connect more with your work?
My work at chirolisa@yahoo.com.
Great.
And also I teach for the ICPA, but that's more for the chiropractors who want to connect. But reach out if you have any questions whatsoever. Please reach out. I'm happy to have a phone conversation with parents who just are looking for more information and haven't found it yet.
I love it. You're a gem of a resource, Lisa. Appreciate you in the community. And thanks for sharing your knowledge with us. And I look forward to
It's
connecting with you again soon.
absolutely
All
been my
right.
pleasure. Thank you, honey. Take
Take
care.
care. Thanks. Bye-bye.